In a significant development on Capitol Hill, the U.S. House of Representatives has passed legislation aimed at extending healthcare subsidies connected to the Affordable Care Act. The bill passed with a vote of 230 to 196, following an unusual bipartisan alignment in which 17 Republican lawmakers joined nearly all Democrats in supporting the measure. The legislation would restore enhanced health insurance subsidies that expired late last year. These subsidies were originally expanded during the COVID-19 public health emergency to help make health coverage more affordable for individuals and families who purchase insurance through the Affordable Care Act marketplaces. What made this vote especially notable was the process that brought the bill to the House floor. A group of lawmakers used a procedural tool known as a discharge petition to force debate and a vote, bypassing opposition from House leadership. This move required at least 218 signatures and ultimately succeeded after several Republicans joined Democrats in supporting the petition. House Speaker Mike Johnson had worked for months to prevent this outcome, arguing that pandemic-era health funding programs should be reconsidered due to concerns over oversight and effectiveness. Despite these objections, the bipartisan coalition pushed forward, citing rising insurance costs and concerns from constituents who have seen premiums increase in recent months. Following the vote, the bill now moves to the Senate, where its future remains uncertain. While there is growing bipartisan interest in addressing affordability issues in health care, the Senate is not obligated to take up the House measure as written. Instead, several senators from both parties are exploring alternative proposals that could attract broader support and eventually become law. House Democratic leader Hakeem Jeffries described the vote as an important step in addressing the cost of living challenges faced by many Americans. He emphasized that healthcare affordability remains a priority and framed the legislation as part of a broader effort to reduce financial pressure on working families. Before the vote, the nonpartisan Congressional Budget Office released an estimate showing that extending the subsidies for 3 years would increase the federal deficit by approximately $80.6 billion over a 10-year period. However, the same analysis projected that millions more Americans would gain health insurance coverage during that time. According to the CBO, the measure would increase the number of insured individuals by roughly 100,000 this year, about 3 million by 2027, 4 million by 2028, and more than 1 million in 2029. Supporters argue that these gains highlight the importance of maintaining assistance for those struggling to afford coverage. Republican leaders opposing the bill raised concerns about fraud and inefficiencies tied to expanded subsidies. They pointed to investigations in certain states that have examined potential misuse of healthcare programs. Critics also argued that the subsidies primarily benefit a relatively small portion of the population and that broader reforms are needed to lower healthcare costs nationwide. During floor debate, some Republicans stated that only a small percentage of Americans rely on marketplace plans and that Congress should focus on policies that impact the entire population. They emphasized the need for long-term cost control rather than temporary financial assistance. Despite opposition from party leadership, several Republican lawmakers representing competitive districts chose to support the measure. These lawmakers cited constituent concerns and rising premiums as reasons for backing the bill. Their decision played a decisive role in reaching the required number of votes to move the legislation forward. The Senate is now weighing how to address the issue. Senate Majority Leader John Thune indicated that any proposal considered in his chamber would likely include income limits to ensure assistance is targeted toward those with the greatest need. He also suggested that beneficiaries should contribute at least a minimal amount toward their coverage. In addition, some Senate Republicans are advocating for expanded use of health savings accounts. These accounts allow individuals to set aside pre-tax money for qualified medical expenses, giving consumers greater control over their healthcare spending. Democratic Senator Jeanne Shaheen, who is involved in bipartisan negotiations, said there is agreement on the need to address fraud while also ensuring affordability. She noted that millions of Americans are losing or have already lost coverage because they can no longer afford rising premiums. Shaheen emphasized that lawmakers are working to find a compromise that balances cost control with access to care. She added that reaching an agreement quickly is important to prevent further disruptions in coverage. Former President Donald Trump has weighed in on the debate, encouraging Republicans to support policies that provide individuals with direct financial assistance for health savings accounts. He has argued that this approach would reduce reliance on federal programs and give people more flexibility. Democrats have largely pushed back against that idea, arguing that direct savings accounts alone may not be sufficient to cover high medical costs, particularly for lower-income households or those with significant health needs. The House vote has also highlighted internal divisions within the Republican Party. By supporting the discharge petition, rank-and-file lawmakers effectively bypassed party leadership, marking a rare moment where leadership lost control of the House agenda. Earlier discussions within the GOP had explored temporary extensions of the subsidies combined with policy changes. However, those talks ultimately stalled after leadership aligned with members who oppose the Affordable Care Act and view the subsidies as supporting a program they believe should be replaced. As insurance premiums increased at the start of the year, pressure grew from constituents across the country. Lawmakers from swing districts, in particular, faced heightened scrutiny as voters expressed concern about affordability and access to care. The Democrats' success in forcing the vote has reinforced their broader political strategy following last year's government shutdown, during which healthcare funding became a central issue. Party leaders have signaled that healthcare costs will remain a major focus as the next election approaches. Republicans, meanwhile, continue to search for a unified approach to healthcare policy. During a recent meeting with House lawmakers, Donald Trump encouraged the party to take a stronger role in shaping the debate, noting past challenges in repealing or replacing the Affordable Care Act. As the issue moves to the Senate, the outcome remains uncertain. What is clear, however, is that healthcare affordability continues to be one of the most complex and politically sensitive issues facing Congress. The decisions made in the coming weeks could have lasting implications for millions of Americans and for the political landscape ahead.